How often should runners follow rehabilitation tips to avoid re-injury? Have you ever wondered how often runners should follow rehabilitation tips to avoid re-injury? This question is essential for anyone involved in track and field, sprinting, or marathon training. Let's break down the details to help you stay on track and injury-free. Runners should integrate rehabilitation and injury prevention practices into their daily training routines. This means making these tips a regular part of your schedule, especially when recovering from an injury. Consistency is key. During the initial phases of returning to running, it is often recommended to run every other day. This allows your body to rest and recover, which is vital for healing. On your off days, consider cross-training activities like cycling or swimming to maintain fitness without putting too much stress on your body. A structured return to running program might involve running 3 to 4 times each week. Gradually increase the duration and intensity of your runs over several weeks. This slow progression helps your body adapt and reduces the risk of re-injury. Strength training and physical therapy exercises are also essential. Aim to perform these exercises about 2 to 3 times weekly. Focus on building muscle strength, joint stability, and tissue resilience. Moderate resistance exercises with controlled movements are particularly effective for this purpose. Regular sessions with an athletic therapist or physical therapist can be beneficial. Depending on your needs, you might schedule these sessions weekly or bi-weekly during intense training or recovery periods. These professionals can help monitor your progress and adjust your rehabilitation plan as needed. To avoid re-injury, keep a few practical points in mind. Gradually increase your running volume by no more than about 10% each week. Avoid excessive downhill running and hard surfaces that can increase impact on your joints. Incorporate purposeful runs with varied paces, but be cautious about doing too many fast runs in a short time. Ensure you have adequate rest and recovery between workouts to prevent fatigue. Pay attention to your body. If you feel pain that worsens or changes your running form, stop and seek professional help if the pain persists for more than a few days. Maintaining consistent strength training focused on major muscle groups at least twice weekly is also important. Use cross-training and active rest days to keep your fitness level up without overloading any injured tissues. In summary, following rehabilitation tips should be a consistent practice throughout your training and recovery phases. Adjust your routine based on how your body responds and your injury status. Regular professional guidance can help you safely return to running and maintain your performance without the risk of re-injury.